92% of Ukrainians are worried that they'll be financially ruined if they become sick. So they don't go to doctors. They self-medicate watching commercials on television. And unfortunately, about 50% of the medicines that are advertised on television in Ukraine don't even have any pharmaceutical effect. They're just some sort of supplements. Many people wait until the last minute to see their doctors, so diseases are found very late stage. And Ukrainians live on average between 7 and 10 years less than our European neighbors. They also have a much lower quality of life. There are many more heart attacks and strokes at early ages, between the ages of 30 and 40, rather than in their 70s and 80s, the way it is in most other countries. So because the system really isn't working, we need to come up with a new way of providing health care. And one of those ways is to change the way that we finance things. That instead of paying for the existence of a hospital, we actually will be paying for services provided, and it'll be results oriented. In other words, we will look at what the results are, and the financing will go to those doctors and those hospitals that provide the best services, that have the best results. The new healthcare laws are simply the method in which we'll be able to do this. So for a year and a half, a group of experts from all over the world, including from Ukraine, worked on a new financial system for financing healthcare in Ukraine. We went through parliamentary hearings. We had a collegium of the Ministry of Health. We also had hearings at the Cabinet of Ministers. This all happened before we even came into the ministry last summer. Last summer, we took this plan and we created a concept for the change of medical financing in Ukraine. We presented it from the lowest level, family doctors out in the regions, all the way up to the Parliamentary Committee on Healthcare, the Cabinet of Ministers, and we finally voted in this concept at the end of November of 2016. In this concept, it's a prerequisite for implementing a new financing scheme is to have a legal structure, to have new laws that allow us to change the way the budget is divided and paid out for healthcare. Instead of paying for facilities, we now will be paying for services. So the structure is this: primary care, emergency care, and palliative care are 100% guaranteed. Each person who lives in Ukraine has those services guaranteed at no cost. To access the system, you need to choose your family doctor or your pediatrician or your general practice doctor and sign up with them. There's an electronic medical system. There's an electronic registry of doctors, an electronic registry of patients. You sign in to your doctor, and that puts you into the system. You don't have to look for a policy. You don't have to sign some kind of forms. You just come to your doctor and say, you're going to be my doctor from now on. I'm now in the system. At that point, all the primary healthcare services will be provided for you, and the financing will happen as a capitation per patient. The doctor will receive a certain amount of money per patient every month to take care of that patient. On the emergency care level, you pay nothing. The services are paid for from the moment you call the ambulance until your treatment is completed. If there ends up being hospitalization, that will be paid for by the National Health Insurance. And palliative care, the services provided for palliative care will be paid for by the National Health Insurance. As I'm saying National Health Insurance, you see that we need to create a new structure called the National Health Insurance because it doesn't exist in Ukraine. It's called Nationalna Sluzhba Zdоров'я, or the National Health Service. And what it will do is it will be the main distributor of financing into the healthcare system. The National Health Service will sign contracts with doctors, specifically doctors if they have their own practice, or with the medical facility, and they will pay directly for services to that doctor or to the medical facility without all of the in-between levels of the oblast level and the rayon level and the city level. So there's a lot of bureaucracy that's being cut out of the system so that we don't have a redundancy and everyone takes their cut of 10% or however much it is. And by the time you get to where the doctor is and where the services are supposed to be provided, there's nothing left for the patient. We're cutting all of that out, and it's going to go directly from the National Health Service to the medical facility.